So in order to support innovation, quality and that quality improvement, we've looked at our mandatory training, and we looked at our supervision, and we looked at our appraisals. And so what we've done on Sunflowers Court and in ARD as a whole is that we've supported staff to ensure that they have supervision on a regular basis. We've supported staff to ensure that they get their appraisals so that they understand what the expectations are of them, and we work with them to achieve their goals. And also we've supported them through their mandatory training in order for them to ensure that they have the training to deliver on the work that they need to do. It's good to know that within ARD at the moment we have potentially the highest supervision rates across the trust. So we're very proud of that, and we continue to work through that and support our staff to ensure that they get the space to have their supervision. And mandatory training is at a very high level anyway across the unit. And again, as managers and as a leadership team, we support our staff to ensure that they're trained in order to deliver safe care and to show that we are a well-led service. We champion co-production by supporting our patients to have a voice. So we ask them about how they're being treated, and we ask them, is the treatment that we're providing for you, are you in agreement with it? Do you believe it's supporting you? How do you think we can make things better for you as an individual? What would that look like in reality? And so we then look at their treatment plans and work with them on their treatment plans. So it's not done in isolation. And that's how we look at co-production with everybody in the room. And that works extremely well because people feel invested in their own treatment, and it makes them feel like we're listening to what they've got to say to us.
Quality is really important for us. So what we've done is use community meetings to really hear, firsthand what patients are saying about the quality. Patients are telling us what they want as part of their care, which means we're not being prescriptive. Patients are being part and parcel of the care that we're delivering. We are also doing lots of work around safe wards. So there's a bit about conflict and containment. And with that, we're trying to work in the least restrictive ways possible. We're having that conversation. Instead of saying this is what is going to happen, we're giving patients some choice.
Co-production, I would say, it starts from the time the patient is admitted and join the service. So that's where the collaborative working starts. We ensure that when patients are discharged from hospital to the community, they have a good quality of life. They have maintained they understand what safety means. They understand that why they were admitted. They are able to sort of go back to the community and live a normal life how they would like to be.
As a directorate and as a trust, we've thought long and hard about sort of what changes, what innovative practice we could introduce that would really benefit our patients and service users. So there's been a number of, for me, I think really key innovations. So one of them was the development of a new ward called the Clinical Decision Unit, which is Picasso. And that unit really enables our patients to be appropriately moved from, for example, an emergency department in a district general hospital, an acute hospital, to get the right care and the assessment. And in that service, there's a team of experts, a multidisciplinary team, who make the clinical decision about the next steps in the pathway for our patients. So they're there for a very short period of time, and we look to discharging if appropriate, or to move to an assessment unit or under one of our home treatment teams. So it's I think, a really healthy and exciting time for the Trust that we're able to bring innovation and our experience to enable our patients to move through our services in a really safe and appropriate manner.
Our ambitions for the unit is to be the best unit in London. We want to ensure that our staff are safe. We want to ensure that our service users get the best care possible, and that treatment means that they come in unwell, but they leave well, and they're well supported, not only once they leave here, but in the community as well, because ARD covers the community services also. And so when people leave here, we want to ensure that they go back to as normal life as possible.